Meanwhile, Ohio Governor Mike DeWine signed an executive order banning gender transition surgeries for minors in the state. During today's press conference, the governor announced several new guidelines for gender-affirming care as it relates to both minors and adults. He says the focus moving forward needs to be on comprehensive care and mental health counseling. Here's his explanation.
Banning them, everyone can be assured that when we're dealing with minors, surgery will not take place. Just seems to me it's a comfort level that we can have, and there's a broad consensus against surgeries for minors. So let's put that into a law so we can move on.
Now, the bill DeWine vetoed last week also would have banned trans girls from taking part in female athletics. None of DeWine's moves directly addressed that issue.
So we know there are a lot of questions surrounding this issue. So for that, we turn to senior health correspondent Monica Robbins to help us sort out all of the answers here. Monica, good evening to you. So where is Ohio on this issue as it compares to other states in the U.S.?
So Ohio is now the second state to specifically ban transition-related surgery for minors. Arizona was the first in 2022. However, more than 20 states banned all gender transition care for minors. A judge struck down Arkansas's law, and 5 other states are dealing with temporary blocks by judges as well.
All right.
Okay, so I think a lot of people wonder, what does the medical side, the medical association, say about this?
Yeah, that's a big question a lot of people had. 23 medical associations and societies oppose state bans and support access to gender-affirming care for minors, including the American Medical Association, the American Academy of Pediatrics, and the American Psychological Association. The World Professional Association for Transgender Health generally does not recommend surgery for minors, and it's important to understand that this surgery is very rare. Reuters commissioned an analysis of insurance claims and found 56 genital surgeries and 776 mastectomies among gender dysphoria patients aged 13 to 17 happened between 2019 and 2021. And the president of the Ohio Children's Hospital Association testified in the legislature that Ohio's hospitals do not perform gender surgeries on minors. However, the governor's concern is that there could be these fly-by-night clinics that possibly could.
And I have read a lot about those concerns because the last thing you want to do is to have your child have surgery in some sort of facility that isn't up to complete state standards. So how do they stop these fly-by-night clinics from popping up and preventing these surgeries?
Well, as Christy mentioned earlier about this other set of rules, so the governor announced a new set of administrative rules for gender transition care for both adults and minors. So they must have a multidisciplinary team of health providers. They must be told of the risks of gender-affirming care and give informed consent before treatment. They also must undergo a period of psychological counseling before receiving hormone therapy. Now, keep in mind, all of this is essentially standard protocol already in place at many of our facilities, including Cleveland Clinic and University Hospital's transgender clinics.
So is there a good gauge of how large the transgender population is here in Ohio?
There are a lot of studies that tried to look into that, but the most research finds that Ohio is 31st in the country for a transgender population, which means about 0.5% of Ohioans.
Okay.
All right, now we haven't heard the last of this for sure because now the House has scheduled a vote to override the governor's veto of House Bill 68. The House will vote on that next Wednesday. The Senate has put the same issue on its calendar, January 24th. Both chambers would need a supermajority to override the veto and keep it from becoming law.
And there's a question whether or not they'll have all those representatives who will be back in time because they're calling them all back early from winter break.
Yeah, so the vote counting is well underway.
Yeah.
Monica, thanks.
Sure.
Thanks, Mon.